Hello, my name is Stephanie. I'm going to be the SLP working with you today, conducting a swallow screen evaluation as your doctor referred you to me for some signs of swallowing difficulties. Can I see your can I see your wrist and tell me your full name and date of birth, please?
Amanda McCorney, 6/24/97.
Thank you. I checked your chart and see that you've had a left lateral medullary brainstem cerebral vascular attack or stroke. Is that correct?
Yeah.
Okay. So like I said, I talked with your doctors and nurses, and they also informed me that you are not awaiting any other procedure, so you're safe to have this evaluation. I see that you're sitting upright with your feet flat on the floor. Please remain to do that throughout this exam. Unless you have any sign or have any uncomfortableness or pain, then let me know and we'll readjust. So I see that you completed the EAT 10 and you had a score of 20, which is not within normal limits for the EAT 10. Are there any foods that you currently avoid or your doctor told you to not eat?
Not really.
No? Okay. Have you changed the types of foods that you eat?
I just eat things that are soft because they're easy to swallow.
Soft, okay. And have you prepared your foods in any different way?
I just cook it so it's soft.
Okay, so patient-reported diet is rated a 5 on the voice. Also, I see that you are alert and cooperative as you could answer all my questions and keep a conversation with me. And you appear to be breathing through your nose at a normal rate, which is good. So now I'm going to assess your speech, language, and voice through a few tasks. So first, repeat some words and phrases after me. Chair.
Chair.
Ball.
Ball.
The father comes home.
The father comes home.
He picks up the paper from the coffee table.
He picks up the paper from the coffee table.
Thank you. And can you name these objects?
House. Tree.
Thank you. All right, so point to your nose, your ear. Thank you. Is 1 pound of sugar heavier than 2?
No.
Can you write a letter with a pen?
Yeah.
Language and comprehension are within normal limits based on this piece of the test. So now I'm going to ask you to do a few tasks for me. First, can you say ah for as long as you can? Thank you. And now do same ah but with which pitch glide. So we're going to do low, high, low whenever you're ready. Yes, thank you. Just like that. And now S to Z. So you're going to hold out S and then Z. So first S and Z. Thank you. Okay, so I'll write those down. So can you now do pa pa pa?
Pa.
Yes. And ta ta ta?
Ta.
And ka ka ka?
Ka.
Okay. And now put those all together. It's going to sound like putaka. Okay, so AMRs and SMRs appear to be irregular, slightly slow, and a different rate, and MPT appears to be within normal limits. So now I'm going to do a few things. First, I'm going to ask you, which involve me touching your face and neck and shoulders, if that's okay?
Yeah.
Okay, great. So first, can you close your eyes for me and tell me if you can feel these touches? Are they symmetrical?
No, the one on the left was lighter.
Lighter? Okay. Did you feel the thing?
Yeah. Mm-hmm.
Are these the same on both sides?
The left is still lighter.
Okay.
I felt it.
Are they the same on both sides?
No, the left is light all over.
Okay.
Yeah. But I can still feel it.
Okay, so facial symmetry is able to be felt but not within normal limits as they are not the same pressure on all sides, even though clinician touch the same on all sides. Okay, so now I'm going to do some jaw movements and feeling. So first, bite down for me. Thank you. Open and close your mouth. Thank you. Side to side. All right, now keep your mouth closed. I'm gonna try to open it, don't let me. Great, and now open it. I'm gonna try to close it, don't let me. Great, and keep it open. So now I'm going to try to push it to either side, and don't let me. So this way, into that way. Okay, thank you. And I'm going to do a jaw jerk. Okay. Now can you keep your eyes open and open as wide as you can, actually. I'm going to try to close your eyes. Don't let me. Okay, great. And now close them really tight. I'm going to try to open them. Don't let me. Okay, thank you. Okay, so now I'm going to use this tongue depressor. And then also, can you puff your cheeks out for me? Smile. Pucker. Say ew, ew, ew.
Ew, ew, ew.
Thank you. And you puff out your cheeks. I'm going to try to deflate them. Don't let me. Here, here. Great. And so now we're going to do a few things. So I'm going to ask you to close down on this tongue depressor. I'm going to try to pull it out. Don't let me. Okay, great. You let go. And now stick out your tongue for me. Lift to your nose, down to your chin, side to side, wiggle. Thank you. Now stick out. I'm going to try to push it either way, to either side. Don't let me. Thank you. I'm going to try to push it in. Okay, thank you. And now I'm going to grab my pen light and do a few things. So open your mouth for me. I'm going to try to elicit a gag, but try to elicit a gag. So first on your right, on your left. Thank you. And now look, say ah, 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 ah,
Ah, ah, ah.
Thank you. Okay. So now your uvula appears to be symmetrical, with slight deviation to the right, and mucosal level was good. You did not elicit a gag on the right. Okay, so now you say ka-ka-ka for me.
Ka, ka, ka.
Thank you. So now, and then also you had good oral cleaning. So now I'm going to do a saliva swallow, and then ask you to do a few more things, and then we can do our bolus trials. So swallow your spit. Thank you, and cough. All right, hold your breath for 5 seconds. Thank you. Okay, so patient demonstrates ability to coordinate swallow and respiration. Also, she has a swallow breathing pattern of expiratory. So now we are going to start your bolus trials. So first we have a 1/2 teaspoon thin liquid, level 0. So you're going to swallow, then say ah when you're ready.
Ah.
Thank you. Again, 1/2 teaspoon, level 0, thin liquid. Swallow when you're ready. Ah.
Ah.
Thank you. All right. 1 teaspoon, thin liquid, level 0. Sorry, that dripped a little bit.
That's okay.
Just water. Swallow. Ah.
Ah.
Thank you. Okay, 1 more teaspoon, thin liquid, level 0. Swallow. Say ah.
Ah.
Thank you. Okay, and so now we're going to do 1 teaspoon from a cup. So swallow and say ah for me.
Ah.
Thank you. I'm going to do 1 more of those. So swallow and say ah.
Ah.
Thank you. Okay, and so now I'm going to ask you to do just a normal sip for you, and this is also thin liquid, level 0.
Ah.
Thank you. All of those have been thin liquid, level 0 so far. Now we are going to move up in consistency and level to a puree, which is level 4. So I'm going to ask you to swallow and say ah, just like we have been. Thank you. Alright, and another 1 teaspoon puree, level 4. Thank you. Okay, so now I have a cookie here. I have 2 of them actually. So we'll first do this. You're gonna chew it and then show it to me. So when you're ready, don't swallow it. Let me see. Alright, you still have a few chunks. Go ahead and chew, chew, chew. Great. Let me see. Okay, and swallow. Oh, cough, 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 cough. Here, take a sip for me. Take a sip. Let me see. Okay, thank you. There's no residue there after your swallow sip. Okay, so I have 1 more cookie for you here. And we're gonna do the same thing. Excuse me. Excuse me. Promise to not get in there. I over that. So it's still sanitized. So now I'm going to ask you to chew again. Don't swallow. Show it before you're done. Okay, great. And you're going to swallow and take a sip. Let me see. Say ah. Thank you. Okay, so that concludes our bolus trials. So patient exhibited no difficulty with thin liquid level 0 of any trials or a level 4 puree. However, she did exhibit a difficulty with level 7, the solid cookie with the swallow. At this time, I would recommend that you have just liquids and purees only and refrain from solid foods until we can do what's called a video fluoroscopy swallow study. So that will be where we take a video of you swallowing and can see the inside structures and know exactly what's going on, as right now we can only see the outside structures. And also, the reason we ask you to refrain from eating those foods that you showed the coughing sign is that could mean that food is going into your lungs and makes you at risk for pneumonia and other health problems. So, do you have any questions at this time?
No.
No? Okay, great. It was nice to meet you.